Please go ahead, sir. We are live.
Good morning, friends. I am Dr. Rajesh Kesri, and I'm going to moderate and I'm going to present this session of our webinar in the series Illness to Wellness. It is very important to be healthy, and this fact has been known and recognized in our society, in our civilization since ancient times. So today we are going to take forward a very important topic, that is prevention and management of hypertension. And we are obviously going to keep in view the current pandemic of COVID and how to deal with hypertension, what effects it is happening on this disease, and how to go on further ahead. So I would like to start with a very ancient prayer that all our Rishi Munis used to pray. Sarve Bhavantu Sukhina. So they used to pray, and we still pray almost daily. We perform this prayer that we pray to God that everyone is happy. And there can be no happiness without health. So health, good health is of utmost importance. But as the life progresses, we catch on diseases, and what we are getting now are the non-communicable diseases. And one of the diseases which is almost 1 in every 3 person is contracting is high blood pressure, hypertension. So we're going to discuss about that, and to throw light on this and to guide us on this, we have to get today a galaxy of stars, experts on hypertension, on lipids, who are going to tell us how this disease affects us, what does it do to us, how to prevent it, and how to manage it if uh, you have hypertension. So we have with us uh, Dr. Raman Puri. Professor Dr. Raman Puri is DM Cardiology, Senior Interventional Cardiologist in the First Apollo Hospital, New Delhi, founder and chairman, Lipid Association of India. Formerly, he was the head Department of Cardiology, Safdarjung Hospital, New Delhi. He is a fellow in cardiology, National Cardiovascular Center, Osaka, Japan, and clinical fellow interventional cardiology, Hospital Charles Nicolle, France. We also have with us a very senior faculty, Dr. Manjinder Sandhu. He is the Director of Cardiology at Artemis Cardiac Care. He is a super specialist cardiologist in Gurugram. I'm going to be short with the introductions because we have little time. And we would also have Padma Bhushan Dr. T.S. Clay joining us soon. He's a very eminent and serious and senior cardiologist. I'm sorry, known nationally and internationally for his expertise and skills. He was one of the founding doctors of the world famous Escorts Heart Research Institute, and he's the executive director from 2007 to 2017. And presently, Dr. Clare is the chairman PSRI Heart Institute, New Delhi. He's had a lot of achievements. There's a very long list of his achievements and the lifetime achievement awards that he's got from different organizations. He's also a DSc honoris causa by Punjab University, and he's got lifetime achievement award from Cardiology Society of India, and there are many organizations and societies. And above all, he's Padma Bhushan. He was awarded Padma Bhushan by the President of India in 2005. So I think this has been the introduction. And now I'd request Shri Anil Rajputji to begin our session with a brief introduction. Shri Anil Rajputji, sir.
Thank you very much, Dr. Rajesh Sikri. It's my proud privilege to welcome such a distinguished panelist, Dr. T.S. Clare, whose introduction has been given. Actually, he needs no introduction. Everybody knows him so well. Dr. Raman Puri, very, very eminent cardiologist. Dr. Manjinder Sandhu, another very, very eminent personality, well known in the NCR region. And Dr. Rajesh Sikri, who is the founder and director of Total Care, who will be actually conducting this session for all of us. Needless to mention that the topic that Assocham has picked up is very, very important and current: prevention and management of hypertension. You see, we all know that this is the disease that is known to be a silent killer. It is estimated that over 1.3 billion people worldwide are affected with this. 1 in 3 cases are there, and this ailment, if you don't have it under control, it can be deadly and have many, many implications on human beings. Elevated blood pressure, as they say, significantly increases the risk of heart problem, brain, kidney, and many other organs, and is major cause of premature deaths worldwide. The rise in high BP cases over the decades have been worrisome, to say the least. If you look at the data, in 1975, there were only 594 million cases that could be attributed to this disease, and this has grown to over 1.3 billion cases during this period. Two-thirds are living in the low and middle income countries. So therefore, it is actually impacting the vulnerable society of the world. In India, ischemic heart disease, which is one of the complications of high blood pressure, caused over 15.5 lakh fatalities in 2017. This is according to national burden estimates of healthy life lost in India 2017. So therefore, we can see the importance that we need to attach to have greater awareness and knowledge about this disease. Many people, when you talk, the common cause they tell you are unhealthy diet, which includes excessive salt consumption, diet rich in saturated and trans fat, and low intake of fruits and vegetables. And in poor countries, this becomes an extremely challenging to have a balanced and healthy diet. Uh, Physical inactivity, which actually is in our own control, but somehow we tend to ignore it. And you know, the kind of lifestyle people are leading today, they actually are so busy that they tend to ignore their health at the cost of anything. So therefore, there is a need for people to have awareness that it is important to maintain healthy lifestyle. Excessive alcohol consumption, obesity are the other such factors which contribute hugely to this problem. Over the last 6 months now, since this COVID-19 pandemic has spread its tentacle, stress levels and anxiety and physical inactivity has only increased. And this has had manifold impact on the health of. So therefore, I am not really expert in this area. We have very, very expert panel here, and I am very eager to listen to them and their advice to all the participants who have joined us to improve their lifestyle and really work on the topic that that Assocham has brought out under the Illness to Wellness series. So I would like to wish this webinar all the very best, and I'm sure that everybody who has joined it will immensely gain from the knowledge and experience and advice of this eminent panel. Thank you very much, and Jai Hind. Over to you, Dr. Rajesh Kesri.
Hello. So I would take the privilege to start this webinar. So I would, if you would allow, sir, I would like to start with a very simple question. We are going to talk a lot about blood pressure, high blood pressure. We're going to talk about numbers. We are going to talk about what is going to happen. But my personal perception is that most of the people, at least laymen, do not understand actually what is blood pressure. So, Dr. Clay, sir, I would like to ask you this very simple question, and I would request you to explain it in few short words to our audience that what actually is blood pressure and why is it important to control it, because people usually don't have much symptoms of it.
Yeah, good morning, everybody. First of all, Rajesh, thank you very much for your kind introduction. Am I audible?
Yes, sir. Yes, sir.
Okay. So, coming to the question of blood pressure. Blood pressure is the pressure which is exerted by our arteries. You know, the pressure in the arterial system. There are two systems in the body. One is those vessels which take blood from the heart to the various organs of the body. They are called arteries. Then there are vessels which take the blood back from the tissues back to the heart. They are called veins. So veins usually are blue colored because they contain deoxygenated blood. Arteries, they look red. The blood is red because it is oxygenated blood. So what is the pressure in the arteries is what is blood pressure. It is the same blood pressure in the left ventricle, the heart muscle, same. Uh, the venous system is a low pressure system. Usually it may be just 2, 3, 4 millimeters or 5 millimeters of mercury as compared to these the pressure in the arterial system. Normal blood pressure as defined by WHO now is 130 by 80 or below in adult population. So if your pressure is below 130 but your diastolic is more than 80, that is also hypertension. If your blood pressure is 150 systolic but your diastolic is normal 80, even that is blood pressure. So you have usually either most of the patients will have systolic as well as diastolic hypertension, but there are many patients who will have only systolic blood pressure, and there is a sizable number of people where systolics are borderline but diastolics are high, like 90, 95. So that's a kind of situation. But when you go to age more than 65, even blood pressure of 140 by 90 can be considered as normal, but not more than that. So now this blood pressure should be measured after taking rest, 10 minutes of physical and mental rest, number one. Number two, in a sitting position. Secondly, we don't declare anybody hypertension with 1 or 2 readings. So we would like to have at least 10, 15 readings spread over 15, 20 days to declare a person that he has got a blood pressure and hypertension. I hope this clarifies the situation.
Thank you so much. Thank you so much. Dr. Manjinder ji, I would request you to clarify, is there any relationship between the COVID infection and high blood pressure? Is it that the people with high blood pressure are more prone or likely to suffer from COVID? Or vice versa, if they suffer from COVID, they might have a worse outcome if they contract it, if they have high blood pressure. Is there any relationship?
I think this myth was started early on when we started having COVID cases, that people with heart disease, hypertension, etc., are more prone to catch COVID, and if they catch COVID infection, they are more prone to have a worse outcome. But now, many months down the line, we have seen a lot of studies from Wuhan, Lombardy in Italy, and in New York, which they have found that the prevalence of hypertension in the general population and that in the COVID cases is more or less the same. So it is not that hypertension patients are more prone to catching COVID. They are as the same percentage as it is the general population. And also, once they contract COVID, it is not that they have a worse outcome, because it has been very difficult to separate the outcomes from coexisting conditions like heart disease, kidney disease, and diabetes. So currently, what we can say is that hypertensive patients are not more prone to be contracting COVID infection, and neither are they going to have a worse outcome.
Okay. Thank you so much. Thank you so much, sir. Dr. Raman, I would like to come to you and ask you one question. Is there any relationship between the lipid levels in the blood, the cholesterol levels, and the outcome of COVID? Dr. Ramanpuri, sir. Can you hear me?
I think he's
okay. Is it okay? Can you hear
need
me?
to unmute. He should be unmuted. I think he's not. He may be still muted.
No, sir,
Can
he
you
is
hear me
audible,
now?
sir. Yes, sir.
I-
Yes,
I
sir.
think
Please
it-
go ahead.
Okay, as far as abnormality of lipoprotein, which we call as a lipid profile, like LDL cholesterol, total cholesterol is concerned, it has no any impact on COVID. But one thing is very obvious that those patients who are taking statins to reduce, especially those patients with coronary artery disease and some of the patients with hypertensive heart disease, they should not discontinue statins, because it has been seen that those patients who have been taking statins, since statin is an immunomodulator, the severity of COVID infection is less in these patients. So we have a very strong recommendations that those who are on statin should continue statin, but there are not enough evidence that we should start statin once you have COVID infection. But regarding whether there is a high triglyceride or low high HDL has shown no so far any impact on this, and rather it has not been studied. Maybe that post hoc after this episode, there are a number of studies will come, and some of these things may become obvious at that time.
Okay, thank you, sir. So I just came across a shloka which I think is very important in these current times. It says, Chintayasht bindu matram vishasha. Chita dahit nirjivam, chinta dahit jivam. The difference between Chitta and Chinta is just that of a dot. But while Chitta is the burning of the dead, Chinta may burn the life. So this is, I think, what has been happening during the lockdown, that people have been worried because of so many reasons, because of the disease and because of the disruption of life. This has led to a lot of stress in the whole population, everyone. So, sir, Dr. T.S. Clare, is there any relationship of stress with hypertension? Have you seen during this COVID and lockdown period, the blood pressure is rising? What has been the response of general population, especially hypertension, to the lockdown period and to the stress associated with that?
Right. See, first of all, I want to tell you that hypertension is one of the commonest disease in the world today. It was estimated in, I think, 2013, 2012, that there are 1.13 billion people with hypertension. And in men, as the data was in 2012, 29.2% of the adult men have hypertension. Females is 24.5%. So roughly more than 1/4 of the world's population has hypertension. That's number one. The second thing is that 2/3 of the patients of hypertension, they are in the low and middle income countries. In fact, the incidence of hypertension is less in Americas. This people say it's a disease of rich people, but it's not so. It's the other way around, actually, which is a very scary numbers. Now another thing is that hypertension, by and large, 95% of the hypertension is idiopathic hypertension. Idiopathic means where we do not know the reason. We don't call it primary or idiopathic. Only 5% of the blood pressure has some removable cause. For example, somebody may have blockage in the kidney artery. That's called renal hypertension. Somebody may have our tube which goes from the heart to the body is called aorta. Some people may have narrowing of the aorta called coarctation of aorta. So renal artery stenosis, coarctation of aorta, sometimes kidney disease. For example, there is a disease called glomerulonephritis, inflammation in the kidney. That causes hypertension. And these are only, there is another disease, there is a tumor in the tummy which is called as pheochromocytoma. So if you have these reasons, we can cure the blood pressure of that particular patient, but mostly 95-96% of the people in blood pressure, they are idiopathic. We cannot cure them, we can just control them. The another thing is that as far as your question was, I forgot the initial question. What was the question, Rajesh?
It was about stress and the relationship of stress to...
Right. Sorry. See, there is no doubt that the stress increases blood pressure. It is not a rocket science, because whenever you are having a stress, the body will release substances which are called catecholamines. Now these constrict the arteries. So whenever there is a stress, any kind, the blood pressure will go high. Now one should also understand one thing. There are patients who will say, "Sir, मेरे को कोई stress नहीं है. I have no stress." There are two kinds of stresses. One is called external stress, which is obvious. Somebody's family problem, somebody's boss is useless, somebody's wife is irritating. So that is called external stress. But there are internal stresses which we don't know. There are stresses at subconscious level. So both, any stress, external or internal, will always raise blood pressure. In fact, patients where the blood pressure is very well controlled, they will spike again if there's some stress coming in their way. For example, if you're driving in Delhi, when you are waiting in front of a red light, I don't think anybody's blood pressure will be normal at that particular stage. So stress has a very, very important role to play in hypertension.
Thank you, sir. Dr. Manjinder, I would like to come to you, and I'd like to ask you. I'd like to ask you a couple of things. One thing is, do children also have blood pressure? Do children also have high blood pressure? Because frequently we think that blood pressure is only a disease of the adults, and quite often they are missed, or sometimes when children come, the blood pressure is not even checked. And what is white coat hypertension? What is converse of that? Because at times what happens is the blood pressure when measured in clinic is very high. At times the blood pressure measured in clinic is normal or low, while when people go back at home and measure it, it is high. So would you please elaborate on some of these aspects? Dr.
Yes,
Manjinder.
actually, it's a very myth that children do not have hypertension. A significant percentage of children do present with hypertension. And whenever children present, in fact, pediatricians nowadays routinely check blood pressure of children coming to their outpatient clinics. And when children have hypertension or young adults have hypertension, as has been mentioned, we should explore the secondary causes of hypertension. What has been mentioned by Dr. Claire as like coarctation of aorta, pheochromocytomas, etc. And this is very important because a lot of times people earlier never used to check blood pressure of children, and they used to go undetected, and by that time we could catch them, a lot of damage would have been occurred in their bodies because of this constant high pressure being exerted by them. And the second question was
about measuring of blood pressure. Sir,
yeah, the white
blood
coat,
pressure कब measure करना चाहिए? What is the importance? What is white coat hypertension?
Incidentally, I'm wearing the white coat right now. And so actually when patients come to the clinic, they are apprehensive. They have had some physical exertion also. So usually the blood pressure which is measured in the clinic is higher, and the blood pressure is measured out of the office, that is at home or on an ambulatory blood pressure monitoring system, are normal. So this is called the white coat effect or white coat hypertension, that when you come to the clinic, your blood pressure is higher than normal. So this is a very well explainable thing because patients are apprehensive and they would have walked and they would have stood in the line to get their registration done, to get their appointment done. So, all these stresses contribute to the white coat hypertension. And in fact, there is another condition which is the opposite, that you could have normal blood pressure in the clinic and can have higher blood pressure outside when you are at home. And that is called as masked hypertension. And so it's very important that we stress upon how do we take blood pressure. Usually in the clinics, the patients just walk in and they sit down on a chair and the sister takes their blood pressure. As has been mentioned previously, that one should allow the patient to take a rest. One should ask actually whether he's just had a cup of coffee or tea or has smoked a cigarette before that, because all these can affect the blood pressure measurement. And the way the patient is made to sit with his back supported, legs should not be crossed. Just unsupported back, sitting let's say on a stool, can raise your diastolic blood pressure by 6 to 8 millimeters. And while crossing your legs while the blood pressure is being taken can raise the systolic blood pressure by another 6 to 8 millimeters. So it's very important how the posture and the rest given to the patient before blood pressure measurement. In fact, nowadays, the recommendation is we use unattended automated blood pressure measurements in the clinic. That is, you have a place where the patient can sit comfortably and there should be no one around him, and you have these automatic machines which carry out a series of measurements, like 7 or 8 measurements over a period of 10 to 15 minutes, and then they give you the average blood pressure. So that's called the AOB BPM measurements, that is automated oscillometric blood pressure measurements. So this is very important, how we measure blood pressure. And whenever there's a doubt of white coat hypertension, the patient should be subjected to ambulatory blood pressure monitoring, which is a 24-hour recording. And we have criteria of the numbers of ambulatory blood pressure monitoring, which are significant. To be like, for example, the daytime average of more than 125 by 70, 130 by 80, or a 24-hour average of more than 125 by 75 is hypertension. A lot of people do not know this. So either, in fact, home readings are also very well validated, that if a person measures blood pressure at home, and that can also be taken to diagnose hypertension or see whether he has white coat hypertension or not. Thank you.
I think Manjinder has said very relevant points, and I totally agree with him. It has been documented that domiciliary recording of blood pressure is more reliable than in the clinic. Though many patients will come, okay, Doctor Sahab, mera blood pressure dekh lo. So if the blood pressure at home is more reliable, number one. Number two, I also want to tell you that how to record blood pressure. First of all, he should be rested, as Manjinder has told you. Number one. Number two, the cuff should be in the center of the arm. The cuff should be at the level of heart. Then most of us, they have electronic these devices, and these devices should not be very old. Change them after every 3 years. Now, when you take first reading, ignore that. Don't include that. You continue the cuff on. Take second reading 30 seconds after that. Take third reading 30 seconds after 30 seconds again. So last two readings, take their average. So this can be as accurate as we can. You know, this is the way to record the blood pressure. And another thing is that people get very upset if the one's blood pressure is 160. So what is a good control? Good control is that if more than 85 of your readings taken are within the range, below 130, 80, 10% reading can be high. Don't worry about those. Some spikes will occur always. So, so these are some of the general, guidelines which a patient need to understand how to control blood pressure, how to monitor blood pressure. Another thing is that, like for example, in an ordinary patient who has a hypertension, how frequently he should record. I just tell them minimum twice a week, maximum 3 times a week, not more than that. Number one. Number two, please go on changing the time. Don't see the blood pressure every time the same time. Kabhi morning, kabhi evening, kabhi before you sleep. And ideally, as Manjinder was talking to you, that there is something called 24-hour BP monitoring system. So we want to know the trend, what is happening. So the least, that's not ideal, and that's not possible every time. We do that only in uncontrolled people, or to document whether he has hypertension or not. But for routine monitoring of blood pressure patients, twice a week is good enough. Go on changing the time. So these are some of the things which you have to remember. Another factor you had asked Manjinder, the hypertension in children. So it's a very, very important question. I will congratulate you on asking this question. Now, blood pressure can happen in children also. Firstly, secondary hypertension, for example, kidney disease, coarctation of aorta, they are more common in children. Pheochromocytoma is more common in elderly people, like middle-aged or elderly people. There has been a survey in Delhi schools. In private schools, the prevalence of hypertension was 8.24%. But in government schools, it was 5.4% in Delhi. And they also checked for obesity. In private schools, it was 3.03%. And in government school, it was 0.07%. And why there is a difference in government and private schools is very obvious. Because private school children are more rich parents. They have more diet, more junk food. And it is a really disappointing to see children of 10th class, 11th class, their tummies are coming out and they will have more hypertension.
Thank you, sir. Thank you so much. Dr. Ramanpuri, I'd like to come to you and I'd like to ask you a very related question. That is, first of all, sir, as you are all into lipids, is there any relationship between the cholesterol levels, between the lipid levels and hypertension? I would also request you to touch upon the issue of children. Is it important to measure cholesterol and lipids in children also? Because frequently when we advise some parents to measure lipids in the children, in the kids, then they are very reluctant to. So please touch on these topics as well.
Okay, it's a very good question. One thing I think I will like to clarify that hypertension is one of the risk factor for coronary artery disease, and high LDL cholesterol is responsible for coronary artery disease. In a layman language, I can say that if you have pressure of 120, we say LDL cholesterol of 90, it has less effect on the pressure wall. So less LDL particle go into the artery. But if the pressure is high, so this means there is a high pressure driving this particle into the artery. So as the pressure will go up, you have high chance of heart disease, even with the same level of LDL cholesterol in two different subsets, one with 190 systolic, other with 120 systolic blood pressure. So this is a relation between two, and of course there are other mechanisms also. Hypertension causes endothelial dysfunction that helps in transporting LDL particle into the subintimal space. Number one. In children, this is the relation between the two. And if you look into the cardiovascular mortality in our country, you will be surprised that it has decreased by 50% in European and in USA, whereas it has gone up by 41% in our country. And 40% of those who are coming with heart problem, they are less than 40 years. And 20% of those who are dying of heart disease, they are less than 40 years. So we have a high prevalence of coronary artery disease and in a younger population. And remember, if somebody has, who has died in 40 years, the disease has started in 10 years, because it takes almost 2 to 3 decades for cholesterol deposit to become big enough to cause, the sequelae of it. So it is very important that lipid profile assessment should be done at earliest. Now, question comes, when should it be done? Like this. See, if a child, the children, parents have history of premature coronary artery disease. Premature means father having heart problem less than 55 years of age and mother having heart problem less than 65 years of age. They become high risk for subsequent cardiovascular event. So in this group of patients, we should preferably have LDL cholesterol done at least at age 11, or if not at age 11, it should be done at least at age 18. Or if those children born with the family history of high cholesterol, parents having high cholesterol, it should be done as early as 2 years of life. So this is very important. It looks very surprising, age, at 2 years, who will do it? But that is the right age to catch. Because if you catch high cholesterol at younger age group, bringing it down to a normal range will prolong his life. Therefore, I normally say that every parents want their children to have long life. So they go to temple and they'll give donation during their birthday. But I request all the parents to go to the laboratory and get their blood sugar and lipid profile done, at least at age 18 or 20, because this is what is going to prolong his life. Of course, you require blessing of everyone, but this is going to help, because some of the children may have high cholesterol undetected. And if we are able to detect at this age, we can prevent dangerous complications like sudden death, which you do see in many young Bollywood actors dying at age 40, 50. Yesterday also one of the director died at age 43. So they are the people whom you can catch hold at a much earlier age, evaluate them why they have high LDL cholesterol, evaluate them why they have hypertension, and if you treat them at this age, I assure that the wishes of all the parents will be fulfilled by the God, because you can treat, these are the preventable disease, preventable or treatable disorders, high cholesterol, you have to bring it down. So at age 18 or 20, every parent, it is a responsibility of a parent to screen their child with the lipid profile assessment and blood sugar assessment. Of course, hypertension is also a part of ASCVD risk factor. So if these precautions are taken, I think hypertension can be detected early, diabetes can be detected early, high cholesterol can be detected early, and I think we can make the life of these children much comfortable, disease-free in subsequent years.
And especially, sir, if someone in the family has a heart attack at an early age, as you were just mentioning, are there any special precautions or any recommendations that you would like to give to their family?
Yeah, this is extremely important, because what is the problem in our country? I will first tell you that we did a study in 2,500 school-going children in the age group of 14 to 18. 2,500. First thing, it was difficult for us to get the consent. Second, we found 7 children with LDL cholesterol more than 230. And to further evaluate them, we require further tests. So out of 7, we were able to do genetic study in 4. And 2 of these people refused, and one of us threatened that they will go to the police, that we are harassing them. So because this is the biggest problem which in our country we are going to face. Now I'm coming to your question's answer. If somebody has a very strong family history of heart disease, as I said, screen for lipid profile at early age, 2 years, 11 years, or 18 years. Number 1. Now we have Lipid Association of India has come out with a recommendation that if somebody has a family history of heart disease, his LDL cholesterol level should be less than 70 milligram. Because when you will screen these children, many of them will have, because his father had a problem, there must be some reason for it. There must be some basic, whether it's a genetic reasons or it is a metabolic problem. So you will be able to define that. So even if it is a genetic disorder, you may not be able to do anything if all the parameters are normal. But if you are able to detect high cholesterol, and if you bring it down, we call it as a familial hypercholesterolemia. It can be homozygous or it can be heterozygous. So if I bring down LDL cholesterol to a level of 70 milligram, first by lifestyle intervention, we will not jump to the drugs, by lifestyle changes, lifestyle advices. In case we fail to, achieve the LDL cholesterol target, then of course with a shared decision. So shared decision means after discussing with a family member that he has to be started on drug, because it is going to help your child to have a long life, event-free life. So if they all agree, we can bring down with the drug under medical supervision, and we can treat them.
Okay, thank you so much, sir. Dr. Claire, a short question to you. We are talking a lot about the numbers, what is hypertension. Shortly, please explain to our viewers, our audience, why should they control blood pressure? Because at times they have to take 2 tablets, 3 tablets, even more tablets, and a lot of restrictions. But why should they control? What happens if it is not controlled?
Very good question. First of all, I want to tell all the viewers today that hypertension is a silent killer. Why it is called silent killer? Because for many years there are no symptoms. Indian patients have a very wrong conception. कि मेरे को तो कोई तकलीफ है नहीं, तो मेरे को कुछ नहीं हो सकता.
Exactly.
मेरे को कुछ हेडेक नहीं, मेरे को कुछ नहीं है. Please note that your blood pressure may be 180, still you may have no symptoms. So the only way to know that you have a blood pressure or not is to please keep it measured. For healthy people who don't have blood pressure at all, I would recommend that at least once in 3-4 months they should check your blood pressure. जिनको blood pressure नहीं है, जिनको blood pressure है वो मैंने बता दिया पहले. I already told that at least twice a week they should monitor theirs. And it is a good idea to keep some kind of a record, so that when you go to your doctor, he will understand how is your trend. I tell my patients always to make a diary of blood pressure. Now, blood pressure, because the pressure is elevated in all the arteries of the body, so it has a negative effect on all the organs of the body. The major effects are on the brain. It causes paralysis, It causes bleeding in the brain, hemorrhage, and there are many people who die because of brain hemorrhage. It's a bad disease. Coming to the heart, it causes two kind of problems. One is, as Baljinder had told you, that it causes blockage in the coronary arteries, atherosclerosis. So it is one of the major risk factors for development of coronary artery disease, along with diabetes, raised LDL cholesterol, the bad cholesterol, and smoking. These are major 4 risk factors. So hypertension is one of them. The second disease it causes is what is called as hypertensive heart failure. Because of the continuously raised pressure in the left ventricle, the heart becomes thick and gradually it starts dilating and it fails. So people will start having breathlessness or pedal edema or incapacity to walk. So it is one of the major cause of cardiovascular mortality today in the world. Hypertension, diabetes, and coronary artery disease. These are 3 major killers in the world, including the underdeveloped world. So that's one thing I want to re-emphasize. In fact, the incidence of coronary artery disease in Indians is 2.5 times more than the Americans. There is a very well documented data that Indians living in USA, Indians living in UK, they have also 2 to 3 times more heart disease as compared to the local population. There's something wrong or something wrong we do. There is something wrong in our genes. That's a different topic we can discuss later on. But we need to realize that the incidence of heart disease and hypertension is much more in India as compared to the Western civilization. And in kidneys, it causes kidney failure. And one of the most important cause of chronic renal failure and stage renal failure is hypertension today in India. And eyes, it causes blindness, very important cause. And then it causes, the arteries can dilate. The major artery, aorta, can dilate. It causes aneurysm. And when the aneurysm ruptures, people die suddenly like this. It's one of the cause of sudden cardiac death. In the legs, it causes blockage of the renal, the arteries of the legs. So when you walk, you get pain in your leg. Actually, I can go on telling the side effects of blood pressure for next 2 or 3 days. Basically, one has to understand that it causes damage to each and every organ in the body.
Thank you so much, sir. Thank you. So it is very important for all of us first to check blood pressure and control it if it is elevated or it is high. So Dr. Manjinder, I'd like to come to you and I'd like to ask you once again a couple of questions clubbed together. One question is that many patients, many especially our diabetics patients, since I'm a diabetes practitioner, they're taking 3 tablets or more than 3 tablets, 4 tablets, 5 tablets, and even after that their blood pressure is not controlled. They try to do everything, but blood pressure is not controlled. So is it important to take all the tablets for, and then are there any other special therapies now, like are there any surgeries which are helpful in alleviating blood pressure? Sir.
Oh, that's a very important question, Dr. Rajesh. See, when we have a terminology called resistant hypertension, we use that term when patients require more than 3 drugs for control of their hypertension. Actually, hypertension is individualistic. It does not matter how many drugs are required to control it. The issue is that the blood pressure has to be controlled. Otherwise, the harmful effects will continue to happen inside the body. So a lot of patients say that we are taking many tablets and, I don't want to take so many tablets. We have solutions for them. There are a lot of fixed dose single pill combination drugs available. In fact, we have drugs which have got 3 or even 4 salts in a single tablet. So I think the clinicians do try to decrease the number of tablets by giving them these, combination pills, which can help them to control their blood pressures effectively. Coming to any interventions which we can do, yes, so first of all, for primary hypertension, that is what Dr. Claire mentioned as idiopathic hypertension. We do not know the cause. So for this, we have a procedure called renal denervation, which had come into vogue a decade ago, but then fell out of vogue because of less of efficacy, but has now come back into favor with some latest trials showing benefit. In this, we insert a catheter into the arteries which supply blood to the kidney. And surrounding these arteries, there is a nerve plexus, the sympathetic plexus. So we, with a catheter, give radio frequency burns and denervate the arteries. So this is an afferent loop of the sympathetic nervous system, which causes the blood pressures to be high by constricting the arteries. So this effect is gone, and then blood pressure comes down. So results are very promising. And in fact, the system has just been launched in India, and soon a lot of our doctors in India would be doing that procedure, which we can offer when we had nothing to offer to these patients earlier. And coming to the secondary causes of hypertension, as those causes are all treatable by surgery or by intervention, like coarctation of aorta can be stented or surgery done, and a tumor, pheochromocytoma, can be removed. Similarly, the renal artery, if it is narrowed, we can do renal artery stenting. So we have all these procedures which can be done in secondary and renal denervation in the primary hypertension, and fixed dose polypill combinations to reduce the number of medicines which a patient takes to control his blood pressure. Thank you.
Okay, thank you so much. Thank you. Dr. Ramanpuri, I would like to come to you and ask you a very interesting question, which I am sure everyone wants to hear from you. That is about the oils that we should use routinely in our kitchen, because we understand that using the right oil is very essential in keeping our cholesterol levels in balance, in maintaining the low LDL cholesterol, high HDL cholesterol, keeping triglycerides low. And one more question, one more thing which I would request you to touch upon is the issue of desi ghee. Is it good? Is it bad? Or in what quantity? Please, sir. Dr. Ramanpuri.
Okay. So I'll start with your second question first regarding desi ghee, because most of us are very fond of desi ghee, and it really tastes good also. There is no doubt about it. See, desi
Yes.
ghee is full of saturated fats, and there is a very strong study which we call as a 7C study. Long back, it was 40 years back, which have shown such a strong relationship between saturated fat and coronary artery disease. 1% increase in saturated fat increases total cholesterol by 2%. Remember this thing. But life, everybody has to enjoy, has to have a good food also. So, and it should be such that everything should be taken, but should be taken in moderation. Like for the problem in our society is this: we take a lot of carbohydrate. If we look into the amount of carbohydrate we consume is around more than 65 to 70%. And it has been clearly seen in various studies, including a pure trial, it was found that if it is as the carbohydrate intake goes up, it leads to increased cardiovascular mortality. So one thing we have to do is we have to restrict the carbohydrate. Now coming back to the oil, is that there is no ideal oil. If you say that which one is the best, I will not be able to tell you which is the best. But what is near to the best, I can always discuss with that. The most important points for the oil is that it should have a sufficient ratio of polyunsaturated to monounsaturated fatty acid. That is very important, because we have three types of fatty acids: saturated, monounsaturated, and polyunsaturated fatty acids. And we should have a ideal combination of poly and monounsaturated fatty. If we go into a conclusion I will not go into detail here. The best oil which we can see is the mustard oil, then followed by rice bran oil, and of course groundnut oil is a poor man's olive oil, because it is almost like what olive oil gives you all the content. But problem with olive oil, which is a predominantly monounsaturated fat, is it has a very low smoke index. Very smoke index means at what time when you boil or you heat the oil, the smoke comes. So which is very high for the desi ghee and some of the oil, and for a good oil to be there, the smoke point has to be high. So olive oil can be used in dressing, as a dressing, or not to be heated and fried. That is very important. You can use it in salad. So these oils which we have discussed gives you a reasonable amount of polyunsaturated fatty acid and monounsaturated fatty acid. And question is this: should we stick to one? I think that it is better if you interchange. And interchange, which is the best interchange, is that you interchange on a daily basis. You know, you take one with predominant polyunsaturated, then you take one with predominantly monounsaturated fatty acid. But it is not feasible. It is not going to be feasible at all, and many people they object to it. But the best way is that if you can interchange oil, a daily lunch with one and dinner with one, which it looks easy to say than to practice, but it is better. If it is not, then you can change oil from one basic oil to another oil when your bottle of that oil finishes. So that is going to be a better choice. So I think this is what on. And third is the quantity of oil. One doesn't mean that you can take liberal quantity of oil. So you can what we have recommended is what LAI has recommended is that 3 to 4 teaspoonful oil per day can be taken by one person. So you can calculate if there are 6 people, then you can multiply by 6, and that will be the daily requirement of the oil. And third thing which I want to highlight is the trans fat. You know, whenever you buy anything, you should always look at trans fat. It should be trans fat free. So in our country, what happens that ladies, they cook food with oil, and next day again they after whatever is left over, it is used again. Next time it is again heated. Here is the time when the oil which you have used on the first day becomes trans fat. So trans fat leads to low HDL, and it has a very strong relation to coronary artery disease. Not only to the coronary artery disease, some other diseases also, like malignancy and all that. So trans fat has to be avoided, and especially trans fat is there in, you take samosas and all that contains a lot of trans fat. So it's better to avoid trans fat. Take an oil which I have said there are 3 or 4 oils which I have said that better to change it. And desi ghee you should enjoy the day you want to enjoy it, but it should not be a practice to have 1 teaspoonful of desi ghee in the morning in your with the food and 1 teaspoonful in the evening. That of course is not justified, but of course everything has to be enjoyed whatever nature has provided us.
Rajesh,
Thank you so much.
Rajesh,
Yes.
I have some comments to make
Yes,
because
sir.
I think this is
sir.
a very, very pertinent question which you have asked Raman. And we know Raman is one of the topmost cardiologists in lipid management in India. Actually, I must compliment him the hard work he has done to spread awareness in India about the lipids. My philosophy is to tell patients, see, trans fat, this fat, that fat, people don't understand. These are two high-fi
Right.
things. We have to come to the practical way. When the patient comes to you, there's no point talking to a man. Can you kaun sa oil use karna hai? He's not going to use oil at home. So first of all, I make sure कि भी अपनी wife को लेके आओ साथ में.
Very true. Very true, sir.
Who's the boss at the home? Because I don't decide what oil is being taken in my home, but to talk of anybody else. So, but my philosophy is to tell patients that, and I want Raman to listen this and comment on that 70% of the cooking should be done in unsaturated fat. 70, that means either safflower or groundnut oil or olive oil. And by the way, olive oil is very good, but the way we cook in India, there's no point using olive oil. There's no point spending the money because then we spoil the oil by हम तो तड़के लगाते हैं ना बुरी तरह से. So 70% of the cooking should be in unsaturated fat. Around 15 to 20% should be done in good quality mustard oil, and 10% of the cooking should be done in desi ghee. Or alternatively, आप देसी घी से तड़का लगा सकते हो. And people like me and you who take 1 roti lunch and 1 roti in the evening, if you want to apply little हल्का सा घी लगाना चाहते हो तो I don't mind it. I don't think there's any harm in that. The second thing about the ghee is that it also depends what is your profession. If you are a white collar person like me and you, what Raman said, those spoons are valid. But if somebody is hardworking, he is अगर पत्थर सड़क पे पत्थर पीट रहा है वो या फार्मर है वो कस्सी से काम कर रहा है and his weight is okay, he can use more. It is a question of calorie intake versus calorie consumption. But on the whole, Raman is very right that there are a lot of data to show that our saturated fats, they increase the incidence of coronary artery disease. So I want to comment from Raman, how do we advise the housewives कि कौन सा तेल यूज करें? Again,
Dr. Claire, I think you have discussed a very practical point, and I totally agree with you what you are saying. But probably I may not agree with the frying and all that part. 70% with the unsaturated and 10% with saturated. Now I'll make it more simple. You enjoy any oil, keep your LDL cholesterol as per target.
Yeah, but everybody cannot. Everybody cannot going to. Everybody not going to test LDL.
I'm not saying that. I'm not saying that. I'm not saying that. I simplified it actually. What I've said, I've simplified your statement. Now, question comes: is it because Claire, the problem is this, that there is poor awareness about LDL cholesterol. There is a poor aware. That is what we have to really tell, that there is a number which everybody should know. What is your number? Like my number is 39. My LDL cholesterol is 39. So everybody should know it. LDL now is not a scaring part. If you know that your LDL cholesterol is high, it is good that you have come to know, because you can bring it down. That is something which is very good. So if you are able to go for a good lifestyle, you are doing regular exercise, you are more liberal in any oil. As you have said, if he takes desi ghee, I don't mind, because some of this oil gets consumed in the calories. So you can be more liberal. That's what I'm saying, that taking about 70 to 80% of Indians are, they are physically inactive. They don't go for a physical activity at all. As far as activity is concerned, one should walk at least 5 kilometers in 40 to 45 minutes every day to protect your heart from cardiac coronary artery disease. How many of us go for 10,000 steps every day, and how many of us go for about 5 kilometer brisk walk in 40 to 45 minutes? We go for a walk with group of 5 people. We are talking around everything and all that. What is your speed? You will cover 8 kilometer in 40 minutes or 45 minutes. So that is the ideal exercise, or physical exercise is extremely important. Any person who is doing good amount of exercise, as you have said, laborer who is doing very heavy work, can be liberal in anything, because that is, and definitely not going to make suffer him. He will not suffer from coronary artery disease at earliest. So I think if you look into the hunter-gatherer population, so these tribes, they take a lot of non-veg. They take raw, what is that called? Smoked meat. Their LDL cholesterol is 50 to 70 milligram. So it depends upon what you are, and what is animal fat is a saturated fat. Predominantly, it is a saturated fat. So it depends upon that. And if we look into our genetic variation, we are more prone to have atherogenic dyslipidemia. If you look into the LDL cholesterol in about 10 to 15% of our population have high LDL, whereas 30% have high triglyceride and about 70% have low HDL, and about 80% of us, all of us, whosoever is in this meeting, 80% of these persons will be suffering from one or more abnormality of lipids. We have got a very high incidence of dyslipidemia, and hypertension adds to it. It makes this fire more prominent. So I think if somebody is doing good exercise, he can be liberal in any way, and we can reconfirm that we are not doing anything wrong by at least once in a year his lab parameters of lipid profile and sugar. Even in diabetes, if you exercise regularly, you do not require anti-diabetic drugs. You can almost cure your diabetes. Similarly, you can bring down LDL cholesterol, and especially triglyceride. You can bring down by 50% by exercise.
Thank you so much, sir. Thank you so much. Dr. Claire, आपसे एक छोटा सा निवेदन.
Yeah,
sir,
carry on.
एक छोटा सा मैसेज सबके लिए आप दें. उसमें एक चीज जरूर बोलें कि ब्लड प्रेशर की बीमारी को कैसे प्रिवेंट किया जा सकता है, एंड प्लीज टच ऑन सॉल्ट. और जो आप सारे व्यूअर्स को बताना चाहें, जो लोग सिंपल लैंग्वेज में समझ जाएं, बिकॉज वी वांट इट टू बी इजीली एक्सेसिबल, कि लोग यहाँ से जाएं तो याद करें जिंदगी भर की उन्होंने ये मैसेज सुना था और ये उनके लिए फायदेमंद होगा. मैं ये आप सब से विनती करूंगा कि आप छोटे छोटे मैसेज जो आपको इम्पोर्टेंट लगे, जो कुछ हमने टॉपिक अभी तक नहीं उठाए, उनको भी साथ में उठाएं और हमारे व्यूअर्स को बताएं. सर, आपसे शुरू करेंगे, डॉक्टर क्लेयर.
See, my message to everybody who's listening here is that in my thinking, there are three things important in life. Number one is health. Number two is health. Number three is health. Nothing is more important than health. Even your girlfriend, your boyfriend, your wife, your children are not important. Even temple is not important. See, if you are not healthy, you will not puja bhi nahi hoti. You know, let me tell you, shabd kirtan sunne ko man nahi karta agar aapko सांस चढ़ रहा है. So most important thing is that we should realize that as early as possible in our life that health is the most important thing. And I want to tell Raman that I'm 67 today. I walk minimum 10 kilometers a day, minimum. My last year average 11.6 kilometers daily. That means I have walked more distance than from Srinagar to Kanyakumari. And I cycle 35 kilometers daily at least. You know, this is my commitment to myself. And I think this is my duty to keep myself healthy so that I can work for my patients, number one. Number two, I should be a role model for my patients. You know, I try to inspire people as much as possible. And if you really want to avoid this triple killer trio of India, hypertension, diabetes, and coronary artery disease, we have simple rules. It's not a rocket science. अपना weight control करो. Weight should be height in centimeters minus 100. जो वो figure आती है, वो maximum weight चाहिए. If you are 170 centimeters, your weight should not be more than 70. Actually 2 kilo कम ही चाहिए. And not only weight, आपका पेट भी ठीक चाहिए. If पेट is coming out, it is an additional risk factor. In men, it should be below 95 centimeters circumference at the umbilicus level. In females, less than 85. सब आपके घर जाके देखना कितना आपका. So पेट, weight and पेट. Number 2, number 3, 1 hour of exercise daily. Number 4, if you have got blood pressure, उसको control करिए. Keep it 130, 80 or less than that. If you have got diabetes, proper control of diabetes. Keep your hemoglobin A1C between 6 and 7. And lastly, but not the, perhaps the most important thing is learn how to deal with stress in life. Stress कम नहीं हो रही, stress बढ़ती जाएगी. अमेरिका में हमारे से भी ज्यादा है. अभी तो गांव में, villages में there is stress, by the way. There is no place in the whole world, there is no stress. So we need to learn how to de-stress ourselves. हमने क्या उसको क्या करना है? It is a personal thing, individualistic thing. I tell you, in my experience, Rajesh, 90% of the Indians are worried without any reason. They have no reason. मेरा बेटा ये करता है, मेरी वाइफ ये करती है, मेरा बॉस ये करता है. अरे भैया, you should blame yourself for your ills, not others. That's my concept, at least. So we need to really de-stress ourselves. And if अगर हमने तीनों disease को conquer करना है, a national level education program should be started by the government in every state. First of all, lifestyle modification. Weight control करो, exercise करो, yoga करो, meditation करो, zero smoke. अगर उसके बाद भी आपका blood pressure बढ़ा हुआ है, then you have to take medicine. Similarly, diabetes. Let me tell you, there are 68 million people of diabetes in India. If they all achieve ideal body weight the way I have told you, 50% will become non-diabetic, 50%. And the remaining 50%, their requirement of drugs will be 25%. So the country will save billions of dollars and the productivity of the whole nation will increase. Actually, it is a pity that the government of India, even the Modi government, so-called progressive government, the GDP for health has not increased. See, the Western world, GDPs are around 8 to 10, 12%. America is 16% of GDP goes to health. In India, it is a dismal 2% or something. So we need to increase public spending on health, and we need very, very important health education program for the country.
Thank you so much, sir. Thank you so much. That was really, really very interesting. Dr. Manjinder, I'd like to come to you and I'd request you to give your message, what you'd like to convey to our viewers. And I would also request you to touch upon the importance of salt in controlling and preventing hypertension.
I think Dr. Claire has given the message for all of us to the viewers. But I would just like to say is that one should know their numbers and be a number crusader of health. जैसे कि आपको डॉक्टर क्लेयर ने भी बताया that we should be clear कि what is the level of blood pressure to be called as hypertension, what is the ideal LDL level, what is the ideal sugar levels, what is the ideal HbA1c levels, So if you are aware of these numbers, you can know whether you are healthy or maintaining the road to health properly or not. And then all the discussion of which oil to use becomes redundant and secondary. As long as everything is under control, then whatever you are doing fine. And not only for yourself, I would make it more important that you should be a crusader for others. You should be looking after the health of the family. You should make sure that everybody is getting their blood pressures and their lipid and cholesterol levels checked up. And why restrict it only to the family? You should also be a crusader for people whom you are encountering in day-to-day life. It may be colleagues at work. If you are having a colleague who is looking obese and who is not walking, you should be responsible that he should start doing exercise. He should look after his own blood pressure. So in this way, we can have a multiplier effect if everybody becomes a health crusader to overall improve the nation's health and thus improve the productivity. And with our dismal government spending, I think we have to take the matters into our own hands to improve our own health. So my take-home message would be that know your numbers and be a crusader for health for not only you, your family, but to everybody around you. Thank you.
Very good message.
Thank you so much, Dr. Manjinder. Thank you so much. That was a wonderful message here. I would just like to put in my small bit that since Assocham is the organizer of this webinar, I would just like to address my viewers and tell them that Assocham has been doing a lot of efforts on creating awareness about lifestyle diseases and especially about diabetes and related diseases. In past 2 years, I think since 2017 till 2019, which I was myself associated with Assocham, we have screened more than 13,000 people. We have checked their blood pressure, their sugars, their HbA1c levels. And last year, we did more than 3,000 screening of total cholesterol and thyroid diseases also. And the figures that we got were really dismal. The control of diabetes, as everywhere in India, is poor. Only about 30% of people or 36% of people have HbA1c less than 7. And the blood pressure control was also very dismal. The cholesterol levels that we measured in the past 2 years were also very dismal. So obviously a lot needs to be done, and whatever messages you are given have to be reiterated and have to be spread again through these awareness activities, especially the contact programs that Assocham has been doing since past so many years. Sir, Dr. Ramanpuri, I would like to request you to give a message to our viewers. What is your opinion? What you would like to address and say?
Yes. In addition to what Dr. Sandhu and Dr. Claire has said, what I'll say that we should give more emphasis on primordial prevention. Primordial prevention is very important. You prevent the risk factors from developing. You prevent hypertension, you prevent smoking, tobacco chewing, you exercise, prevent diabetes. So more emphasis has to be given on primordial prevention. Once provided you have a disease risk factor, then it comes primary prevention to prevent heart attack and all that. So more emphasis in this thing. And second, which I want to say is that it is, as we all know, that lipid is one of the major risk factors for coronary artery disease. It may not be the major risk factor for stroke, where hypertension is a major risk factor for stroke. Two are different. Stroke is risk factor, main risk factor is hypertension. For coronary artery disease, risk factor is cholesterol. So we have to know our lipid profile, and as a doctors, those who are doctors must make sure that all their patients lipid profile assessment is done whenever the patient comes to you. And number two, every parent should get the lipid profile of themselves, of course, and their children also, because if you detect hyperlipidemia at younger age group, I think the parents have done their job justified by preventing heart problem in their children in near future. Number two. Number three, what I want to highlight here now is that most of the time we go for a fasting lipid profile. We go to the lab, says you come fasting, we'll go fasting. In our country, fasting lipid profile is okay, it's important. We should have 1 or 2 reading of fasting profile. But since we have high prevalence of triglyceride, postprandial or non-fasting lipid profile is extremely important for us. Remember one thing. So getting a non-fasting lipid profile is important because heart disease has a strong relation with postprandial high triglyceride. Higher is the triglyceride in the non-fasting state. You remember 18 hours out of 24 hours, we are in non-fasting state. Only for about 4 to 6 hours or maximum 4 hours, we are in a fasting state. Fasting means 8 hours after your last meal. So it becomes almost 4 hours or 3 to 4 hours you are in real fasting. Your arteries are exposed to lipids, lipoprotein abnormality for 18 hours to 20 hours. That is more important than the abnormality which you have in 3 or 4 hours time. So always you tell your doctor that, doctor, why we should not go for a non-fasting state. So get your non-fasting lipid profile. It is an extremely important for us to prevent the coronary artery disease. Fasting is important because our target is LDL cholesterol, so we require LDL cholesterol assessment done by the fasting LDL cholesterol. But otherwise, postprandial triglyceride is extremely important for us.
Rajesh, can I give my comments?
Yes, sir. Yes, please.
See,
Yes, sir, please.
there has been a lot of very good input from Dr. Ramanpuri and Manjinder, and I must compliment them, my colleagues. See, I also want to say that Assocham has done a very good job to take a topic which is highly, highly important for the nation, and I must thank Anil Rajput for that. The second thing which I want to tell you is that, in my opinion, either there is no God, or if the God is there, he's Harami number one, and I want to prove that. No, I want to prove that. If you see the longevity of life in the world, Hong Kong, Japan, Singapore, Italy, Spain is more than 84 years. Monaco is 86, average 86.5 or 87 years. If you go to poorer nations like Central African Republic, Chad, Lesotho, it's around 53 years. हम कहते हैं परमात्मा एक है, परमात्मा एक है तो भाई उनको क्यों मारता पहले जल्दी, you know? And इंडिया में we believe कि हमारी किस्मत लिखी हुई है, जितनी उम्र लिखी हुई है. It is wrong. It is not like that. परमात्मा ने लिखी हुई. Why a person born in Monaco has 35 to 40 years more to life as compared to African countries? Why? The difference is not God. That is the drama. The differences are GDP of those countries, education level, hygiene standards, the standard of medical care, and personal health awareness of these people. So please understand that we can do a lot good to our nation if we understand all these things and compare ourselves with other countries. Even in SAARC countries, by the way, India is not number one. The Bangladesh is 72.3 years of longevity. Number two is Nepal with 70.5. India is number 3, 69.4. That is the situation we have to understand. Bangladesh health statistics are better than India, and this is what I want Assocham to understand and convey to the government of India.
Thank you so much. Thank you so much. Thank you so much to all the panelists for all the wonderful information that you have given to our viewers. The viewers are very happy. There are a lot of questions also. I think most of the questions have already been answered during our discussion. There is one question I think interesting, that is about Fabry disease. One of the viewers has Fabry disease, and he says that his blood pressure keeps on shooting up and down, and he gets sort of headache. Anyone would like to comment on this Fabry disease, sir?
Which
So
disease?
this also is Fabry disease. This is a rare genetic disease. It's a rare genetic disorder.
Manjinder is more educated. He will answer.
Fabry's disease is a very rare disorder of a glycoprotein, and in fact,
Yes.
I have had a patient from Africa, maybe Nigeria, who we tested for Fabry's disease, and he came positive. So in that, it affects quite a few organs, including the heart, the kidneys, and high blood pressure is a consequent side effect of involvement of all these organs. So what the issue is that we treat hypertension by conventional drugs in these cases, and if he's continuing to have headaches, that means his blood pressure is not adequately controlled, and he must visit the clinician to get his drugs adjusted so that his blood pressure is absolutely controlled. And sometimes the vessels of the brain can also be affected, so maybe a scan of the head and MRI of the brain can also be indicated. Thank you.
There's one question which I would like, sir, to Dr. Clay, you to answer. That is I think, very, very important. Someone is asking, my blood pressure is now controlled, can I stop taking medicines?
Very
Sir,
good question.
this
Very,
is a
very
big
good
misconception.
question. No, I say very good question. So India is a very interesting country, I tell you that my father had hypertension and I started him on medication. And after 6-7 months, I went to Punjab, I'm from Punjab. And I asked my dad, ki haal chal hai? He said, बहुत अच्छा है. तो मैंने कहा जी, what about your blood pressure? तो कहते ठीक है जी, मैंने कोई तकलीफ नहीं. मैं जी दवाई खा रहे हो कि नहीं? नो, मैं बंद करती. मैं जी क्यों? He said, मैंने सोचा कि आदत पड़ जाएगी दवाई खाने की. This is the condition of a dad whose son is a cardiologist. So I can't blame the general population. Remember one thing, that once a hypertensive is always hypertensive. Now, but there will be situations when the blood pressure will be normal without medication. It may be 6 months, even it may be 1 year, it may be 2 years, but a stage will come back again when the blood pressure starts rising. So yes, first of all, we reduce the medicines. If a patient's blood pressure is very well controlled, we grow gradually. And if a PP is still okay, we stop the medication. But I tell them very clearly, please don't stop monitoring, because a phase will come back again when the blood pressure starts rising. Yes, medicine can be stopped, they can be decreased, but monitoring has to be continued, because when needed again, we have to reintroduce medicine. I hope that
Thank you, sir.
answers the question.
Yes, that answer is very well said. Thank you so much. Thank you to all the panelists. I would now request Shri Anil Rajputji sir to conclude the session by giving his vote of thanks and concluding. Sir.
Thank you very much. Before I start my vote of thanks, somebody has sent me a SMS requesting whether cod liver oil or fish oil is good for healthy heart. So I would, on oil, I also got one question which I thought I'll share.
Now
Request
coming
for your
to sure. Coming to the fish oil, this has been a very controversial point for and a lot of debate has been there. The oil which is good right now is we call it as a icosapent-ethyl ester, is a omega fatty acid which is shown to reduce Now coming to, and this is this has been used in various cardiac diseases and patients with diabetes with some other risk factors. But if you look into the fish oil as such, it comes into capsule form also. The only problem with fish oil is this, that about 50% of the oil in this fish oil is unidentified. We don't know what those oils are. So there has been a letter to FDA that the on-counter sale of this fish oil has to be stopped. Now, number three, whatever is the omega fatty acid, DHA and EPA in this fish oil capsule, it has been again a very controversial discussion whether they do prevent heart attack or cardiac problems or not is there. So far, there are disputable statements from various trials. And one of the meta-analysis which has been published recently by Mayo Clinic, they do recommend 1 gram of fish oil. If taken regularly, it does reduce cardiovascular mortality in long run and sudden death, especially in elderly persons. So we are not going to say no to the fish oil at present in dose of 1 gram per day, but for cardiac preventive purpose, this probably may not be the correct. There we have to have a more special, preparation, which we call as icosapent-ethyl ester, which should be taken in dose of 4 grams per day.
Raman, before I give Anil to speak the final words, I want to ask you: is there any scientific evidence that taking fish on a regular basis helps?
Yeah, that's
fish
very
oil,
important. Yes. So it has to be fatty fish, number one. That is very important. And second, that you should not deep fry it. That is number two. These are the two important points which has to be considered when you are taking fish. Twice in a week or thrice in a week, having fish is always useful. But only thing is that it does contain some mercury. That probably may not be good item for pregnant ladies who are, preferably should be avoided during pregnancy. Otherwise, having fatty fish 2 to 3 times per week is recommended also by the American Heart Association at present.
Thank you.
Thank you so much, sir.
Thank you very much for very, very engaging discussion. And I'm sure, all the participants are carrying a very, very important message from each of the panelists. I would like to thank Dr. Claire for spending time with us and giving us message that internal stress and external stress both have to be monitored. Because you might feel that there is externally no stress, but there could be a huge amount of internal stress. Healthy people should also check and record their BP regularly. Indians have more prevalence of BP problem, so they have to be even more careful on this. And last but not least, he has given a very, very important message saying there are 3 important things in life: health and health and health. There is nothing more important than health and health and health. Weight and weight both are important, and people should go back and measure and make sure that they are in the right parameters. Health education awareness program for India and message for Assocham to carry it forward with the government is very important, and I'm sure Assocham will do its utmost in carrying this message forward. Dr. Claire's message that health is in your hand. It is not in God's hand, and I'm sure all the participants have listened it carefully and take appropriate measures in this regard. I would also like to thank Dr. Majinder. Majinder Sandhuji has given a very, very important message to people. People with or without BP have the same risk during COVID-19. People should not actually be scared or afraid because they have this problem, that they are at a higher risk. I think it's a very, very comforting and important message for people. Children and young people are today having blood pressure, so it is not important that you only after you attain certain age you need to check your blood pressure. At any stage you can have this problem. His message on white collar hypertension, mass hypertension are another good messaging, how people need to deal with it, what they should do. Resistance towards hypertension, it could be individual. BP has to be controlled all the time. Monitoring is very, very important parameter. You should always monitor your parameters. Health of the family, for the entire catchment area, you need to become a health crusader for the society, which I think some of the takeaways that are available for all the participants who have joined this webinar. Dr. Raman has made a very, very important contribution during the panel discussion, where he talked about high prevention in younger adult. Lipid profile has to be done early. We don't have to actually grow old to begin to monitor on this parameter. High cholesterol in parents, their children should definitely go for an early detection of lipid, because it has a very, very high chance of them having the problem. Relationship with health, quality of oil, trans fat free oil should be consumed because that can cause a huge amount of problem. At the end, prevention is better than cure. If you're not taking preventive measures, nothing can actually help you, because ultimately when you get the disease, then you have to go and run around to get yourself cured. So if you can take preventive measures, get lipid profile regularly checked, know the lipid profile, not only fasting, even post-fasting lipid profile is important for people to monitor their parameters. So thank you very much, all the panelists. And last but not least, Dr. Rajesh Keshri, who conducting this webinar in such a wonderful manner, raising all the pertinent questions for the benefit of all the viewers, and these messages will go a long way in keeping our nation healthy over the years. And this will also help in reducing overall cost of health for the people. So I like to thank everybody and Assocham and Assocham team for organizing this webinar. Thank you very much. Thanks a lot. Thank you.
Thank you so much. Thank you. Jai Hind. Thank you.